times of need. We are equally grateful to Indian institutions, companies, organizations, and individuals who have stepped forward through expressions of solidarity, material support, donations, technical assistance, and continued engagement. I would also like to acknowledge the Indian public who continue to visit Sri Lanka as tourists and to encourage others to consider doing so as we recover from the effects of the cyclone. Tourism supports livelihoods, sustains local economies, and contributes directly to national recovery, including our ability to invest in essential services such as health. These gestures, whether large or small, speak powerfully of the closeness between our peoples. Ladies and gentlemen, it is against this backdrop of strong foundations, present stress, and a clear reform mandate that today's discussion becomes especially meaningful. Your presence reflects some of the expertise Sri Lanka seeks at this moment: medical equipment and devices, pharmaceuticals, diagnostics, hospitals, digital health, education and training, regulatory frameworks, and investment. Sri Lanka is looking beyond short-term solutions. We seek credible long-term partnerships that align with national priorities and contributes to recovery, reform, and resilience. India, with its strengths in affordable healthcare, manufacturing, innovation, human capital, and service delivery, is a natural and valued partner in this journey. Today's meeting is intended as an open and constructive exchange and an opportunity to listen to your perspectives and to explore how interests, expertise, and priorities can come together in practical and mutually beneficial ways. It's now my honor to invite the Secretary to the Ministry of Health, Dr. Anil Jayatissa, who will make a few remarks, and the Honourable Minister will intervene thereafter, and the floor will be open for discussion. Thank you very much once again.
Thank you, Dr. Nalinida Jayatissa, Honourable Minister of Health and Mass Media, Her Excellency, the High Commissioner of Sri Lanka in India, Ms. Mahishini Colonne, Commissioner of Ayurveda, the consultant attached to the Ayurveda section of Ministry of Health and Mass Media. Ladies and gentlemen, first and foremost, I'm indeed too happy to see you coming in numbers. I know it's not easy, for all of you to come for such a meeting. I think that's simply because the High Commissioner and the team has organized this in a manner, and of course we discussed about this meeting several times. And I believe that you got what we mean through her speech. I think we dealt with many aspects of healthcare development in Sri Lanka, what we are aspiring. Now, to say that we have a new government of Honourable Health Minister. Of course, Indian investors have been investing in Sri Lankan healthcare in a significant manner, and there are a lot of multinational companies dealing with equipment, and they are basically in Delhi, and so through Delhi only we get services in most of the cases. I think what we need is to have this relationship to be more advanced and more penetrative. Now, I will not talk much because we have to save time, but as Her Excellency mentioned, we are keen on digital medicine, including telemedicine, but there are a lot of other areas. And especially the new government is into certain reforms in healthcare, which will, where the healthcare will get more closer to the grassroots. As it was mentioned, Sri Lanka is an example when it comes to many healthcare indicators, especially in public health area, the preventative area. But now we are dealing with the double burden, the preventative as well as actually more towards NCDs, and it comes from the aging and the behavioral and all other environmental factors. As you know, all public health is not very costly, but now the health is very costly. And in Sri Lanka, healthcare system is funded through taxation. So we don't have much of insurance. You see, of course, individuals can get insured, but that's maybe high income groups and middle income groups. But otherwise, basically, even middle income groups, majority, they don't go into insurance. So it's about the government delivering healthcare through taxation. That you have to understand. So now when we getting closer to community means the new Honorable Minister's government has introduced what we call Arogya, where there will be one health and wellness center for about 10,000 population, where many things happen. From the NCD screening to palliative care to geriatric care. One of our major issues is our primary health care is very much less used. So if you take the triangle, primary, secondary, tertiary care, the primary care is much less used, and secondary and mostly the tertiary care really congested. So it's a triangle upside down. So idea is to take the triangle in the right way. For that, we need that people to stay home as much as possible. Them to stay in their villages, townships, so that they make use of primary health care as much as possible. So therefore, you can see in time to come, much of investment will go into primary care. So that is why we say that we need maybe diagnostics, point of care diagnostics maybe, and then the telemedicine, and then digitalization, because you can't simply ask them to stay in the village unless we really look after them. To look after them, we have to be really ready for that, the healthcare wise, technologically. So I know that this technology is available in India. So that's why the Honorable Minister is very keen on this meeting. And then of course, if you take secondary and tertiary care, I'm just giving few examples just for you to get the idea on it, because otherwise I have to speak at length. Now we have dialysis units, right? So all this time, the government used to spend capital on dialysis and then spend recurrent on solutions. and staffing, everything. But the Honourable Minister took a cabinet paper to the cabinet, which which will enable the investors to come and set up dialysis units. I mean the capital cost and the solution cost. The staff will be ours, and we pay a fee for service. So that is one thing. So now, from now onwards, we will not be investing totally 100% in dialysis units. That is one. And another area is high equipment like cath labs, liniacs or whatever. So that is an area where the government is spending lot capital. So we would like investors to come and invest in high level equipment, and then once again, but the staff will be ours because we can't reform everything. Then again, fee for service. So that's one. And also, even a little while ago, Honourable Minister was talking to me, investing in hospitals, private health sector, as much as possible. And also we have several hospitals, modern, with very good infrastructure, but for certain historical reasons, idling. One is there is KDU, we call Kotalava Defence University, attached to Sri Lanka Army. You get everything, I mean fabulous infrastructure, but part of it idling. And again there's this another hospital called Neville Fernando Hospital, where some time ago private medical college was to come in, which didn't come in, and then the hospital still operating but at a low key, but it has got even high level equipment. So maybe investor to come and invest in such area. So I mean they are either, but I am sure this engagement is a initial step, but thereafter I think we got to sort of have the relationship and to work out in whatever the area that you wish. It's not enough that for us to say what we want, but then you have your respective areas that you would like to invest. So and India being our big brother, we certainly like India to play a key role. So I don't want to say further anything. Honourable Minister will engage with you. Thank you very much.
First of all, I highly appreciate your presence here, the invitation of High Commission of Sri Lanka, and I want to thank not only to the Indian government but also to the business community and Indian citizens, the support, assistance you are giving at a very crucial moment when we experience the most severe natural disaster in our history. Still we are recovering, and since 27th evening from your side you are assisting in every ways. Since the relief aircrafts deploying from INS Vikrant, still you are assisting us. And on behalf of Sri Lankan government, I want to thank you again and again, because your support of technical, financial, medical, and relief assistance. It's in every way. It's a timely need to our country. And talking about the health sector, the Secretary to the Ministry of Health and Mass Media, Nalinida Jayatissa, emphasized well our needs. You know, we are having a population of 21.7 million, and when you consider the tertiary care hospitals, we are conducting by the public, the government, 60 tertiary care hospitals, including 3 national hospitals. And we are having 62 base hospitals, so altogether we are maintaining the health system, running 140 tertiary and secondary care hospitals. In the private sector, it's not much common. We have 35 to 40 private hospitals, especially in Western Province, Colombo, Kampa and Kandy. But in areas like Northern Province and Eastern Province, there are no big private hospitals. They are having small, either medium scale private institutions. But there are nearly 6,000 dispensaries, stations where GP practices are running. That's by the government doctors. In Sri Lanka, the doctors who are serving in the government, they can do the private practice. So they are running these dispensaries after their duty hours. And now we are reorganizing the health sector from the tertiary to private care. That's why our secretary said our plan is to establish nearly 2,000 primary care institutions in the country. Already we have 1,100 primary care institutions, including divisional hospitals and primary care PNCI, like central dispensaries. There we have 1 to 5 number of doctors and nearly 15 to 20 health staff. And especially now in certain areas we need your engagement, we need your intervention, like cardiac or heart surgeries. When we consider the figures of National Hospital in Colombo, they are having a long list for open heart surgeries. Like in National Hospital Colombo, it's the list is nearly 5 years. That is nearly 10,000 people are waiting for bypass surgeries. 4,000 people are waiting for angiograms. That is nearly 9 months waiting list. In Kandy, maybe nearly 7,000 to 8,000. So we have a big waiting list for the heart surgeries. By the funds of Government of Sri Lanka, we are going to install certain cath labs in next year, but it's not adequate to overcome this challenge. So this is one sector you can engage with the sector of heart surgeries. Our request is to start the hospitals which can do heart surgeries in Sri Lanka. But meanwhile, we are thinking to send certain patients to India also with the government budget. That is, to save their lives. That's an immediate solution. And the other burden in our country is the prevalence of cancer patients. This is the most common reason for the deaths among female. It's a cancer, number one, and among males, it's the second most common reason. Number one is the heart cases. And we are having specialized cancer hospitals, and also in certain district level hospitals and in certain teaching hospitals we are having cancer units, but the facilities are not enough. You know, the cancer patients are, most probably they are from very low economic background, so government can assist them, but for the drugs and for the lean accelerators and other high-end equipment, we are investing a lot in spite of the outcome. And now Sri Lanka we are having a growing tourism sector. In this moment also, in this year, in 2025, we have nearly 2.2 million tourists. So medical tourism will be developed in next few years. Still, either the government sector or the private sector is not very much interested in this medical tourism. Even Lanka Hospital, that previous Apollo Hospital, the Lanka Hospital, and certain private hospitals in Colombo, there are 3 or 4. They have interested, but I think if we can develop this medical tourism sector, one from India, from Maldives, and from other countries, we can get the patients. And also, the Sri Lankans who are living abroad, because of our health system is somewhat low cost, they are very keen on to come there and to get some surgeries. So it's one opportunity to develop. And Ayurveda sector. Ayurveda is, we have this traditional medicine for a long in the history, but still it's not much developed. So in parallel to the medical tourism, I think you have opportunity to develop this Ayurveda sector also. And regarding our pharmaceutical and devices, we are expending nearly 400 million USD for pharmaceuticals and 200 million to devices. That is in Sri Lanka rupees, which is nearly 160 billion rupees we are expending to the pharmaceuticals and devices. Out of them, in our needs of the public sector, 25 to 30% are fulfilled by the local manufacturers, but 85% of our pharmaceutical requirement we are getting from your country. And we have accepted the IP, USP and BP. So my request is if you are willing to start the manufacturing sites in Sri Lanka, it is very much easy to the registration, to the regulation process. Otherwise, there are certain issues in imports drugs and devices about the regulation. So if you can invest there, you can start the manufacturing site. It's very easy for us. And Secretary mentioned about the diagnostic issues. From primary health care, we want to introduce the point of care facilities, that is for not for the each and every institution, but at least for 10 to 12 primary medical care institutions. We want to introduce these diagnostic centers, that is, then we can cover these institutions within 10 to 12 kilometers. And beyond that, I mean, in a secondary level, if you are having the central diagnostic centers for 2-3 base hospitals, then I think that's a better way. Otherwise, we don't want to start investigation centers in each and every hospital. And as he mentioned, last time also I proposed, now we are moving to give the opportunities to install high-end equipments in our hospitals, like in by this disaster, one of the district general hospital in Chilau, most of the equipment damaged, including the CT. So we can actually give you, you have opportunity to install the high-end equipments, and that is, I want to get rid of burden of maintenance of these equipments. That's a very big burden to the health sector, and we don't have enough manpower and expertise and engineering capacity in our side. So if you are getting the burden of installation and maintenance, then we can pay for the service. And the technology is upgrading very fast, and so that's why we are trying to invite you to invest on this sector. And the construction of infrastructure is, you know that it will take time, and it has no end. Every time the requirement for the construction is going on. The solution, what we think that the solution for to develop the access to the health sector and to develop the sector is, the best thing is to introduce the IT, digitalization. Last 10 to 12 years in the health sector, they have been trying to digitalize the system, but it's not in a satisfactory level. During the discussion with the State Minister, I requested from the Indian government to assess our system, IT system, and identify the gap. And I want to invest from this side also, the IT sector. And last, you have opportunity to construct, to build the apartments in our health system. Like we don't have enough, we can't provide the enough accommodation for our health staff. Now what we are doing is we are completing the unfinished constructions for last 10 to 12 years. It is a huge cost to the government. So we invite you to, if you can, as real estate, you can invest to the apartment. We can give you the land, and we guarantee you to, for 10 years, 8 to 10 years, we can pay the rent. That is not only for the health sector. When you build apartment in towns, in remote districts, it's an opportunity to for the whole other professionals also. Right? It's a good opportunity. This first time we are going to introduce this kind of public-private partnership in accommodation construction to our country. And those are the areas you can engage in, and I want to listen to you. And again, I want to appreciate your assistance, and as a neighbor, as a good neighbor to your country, we want to be a part of your economic development. You are becoming the economic giant of the world. I believe that you can reach that milestone within next few years. So we want to be a part of the coexistence of the Indian Ocean, and as a good friend and your neighbor, we are following you, and we are always to share the economic benefits between our people. So our aim is to develop our nation. You know, we have experience. We have a history of 30-year war, and now we faced severe disasters. But anyway, on this platform, we have to stand now. So we really appreciate your cooperation, and